evening and welcome to an all brand new episode of Hala Kuwait. I'm your host Fatma Al-Hajri and we're coming to you live from the Ministry of Information right here in downtown Kuwait. Of course, this evening I am joined by my co-host Mohammed Leblouchi. Good evening, Mohammed.
Good evening to you, Fatma, and good evening to you, dear viewers. Please, before we start, sit back, relax. We promise you we have reports, segments, and guests to talk about different topics from different fields. Definitely, we have different subjects. We have a very interesting guest on tonight's episode, Fatma.
Of course, Mohammed, we don't want to spoil anything. So let's watch the first report for this evening. It's about fitness.
Stay tuned for the next guest.
But today we have with us our guest, Dr.Mathew Koshy, dentist and certified digital smile designer. So, of course, it's a pleasure to have you here in the studios of Hala Kuwait.
Thank you very much.
Of course, we'd like to know more about oral health, how it plays in, of course, the health conditions.
Yeah, okay. See, oral health plays a great role in the general health condition because as you know that mouth is the entry point for all the organisms. So now research has found out that like if the mouth is not clean, it has got a relation, an adverse relation even with your heart and also in case of diabetes.
Of course, I think I heard someone say once, sometimes even if you have a teeth cavity, sometimes it's related to the heart and might even tell you if you have possible heart attacks in the future.
Yes, you are exactly right. So as you said correctly, the relationship is too much. So I advise everyone to take good care.
So what do we need usually for the dental checkups? How frequently should we go?
Okay, see, generally we say that you have to have a dental checkup once a year, at least once a year, okay. But for some people, like who are prone to caries or who have got too much of dental problems, personally I advise them to come for a checkup once in 6 months. But that's just for a checkup. During that checkup, we will do a real good checkup, and if there is anything to be done, we will do it. If not, we'll ask them to come back after 6 more months. But generally, once a year would be enough.
But it would be better to be checking up on your teeth every 6 months.
I would sincerely advise to do so.
Of course, and I think one of the main issues I think for a lot of people when it comes to checking up their teeth, because even during the normal checkups, sometimes you have to do x-rays.
Yeah.
And I think a lot of people might be afraid of the side effects of x-ray. Is there any negative side effects?
Okay. See, generally, dental x-rays are very safe because the amount of x-ray radiation dosage which we use is very minimal, okay. So because of that, it's very safe. And also, like we are putting lead aprons and all that to protect the person from getting any harmful effects, if at all, from the x-ray. And the dosage is very minimal, so it's not harmful at all.
Of course, and I think one of the questions I think a lot of people might ask, when you put on this apron, do you have to remove all metal objects when you're doing the x-ray, or is it fine just staying as you are? Because it's just going to be on the teeth.
No, we advise everyone to remove the metal objects so that it's not shown on the x-ray and like to be on the safer side.
Of course. And I think a lot of people usually wonder, why do we have cavities and why do holes appear in our teeth? Because I think even if we take care of our teeth, brush frequently and even floss, sometimes they may appear.
Okay. So to give an answer for that, I might take a little more time. Okay.
Of course, take your time.
Okay. See, the cavities are caused by the foods which are attached to our tooth, okay, and which are attacked by the microorganisms which are inside our mouth, okay. Now, when the microorganisms attack the food, it produces certain byproducts, and those byproducts contains acids, and those acids attack the enamel. Even though enamel is the hardest substance in our body, it attacks the enamel, and that starts the process of caries or decay. And if left untreated, it will go deeper, and once it reaches the next layer, which is called the dentine, then it really goes faster, and then it goes to the nerve, and mostly people do come at that time because they do have the pain. Before that, generally people don't come. That's why we advise everyone to come for a checkup, because before reaching that stage, we can prevent it.
Of course. So what you're telling us right now is we usually notice the symptoms after it hits the nerves.
Yes, because once the pain starts, like for the pain to start, mostly it should reach at least the dentine, if not the pulp or the nerve of the tooth. Okay, so mostly people do come only at that time.
Of course. So there's no other types of signs when it comes to dental cavities other than the nerves, when it hurts the nerves?
No. See, easily we can find out. Like, I'll tell you how. Just open your mouth, like stand in front of a mirror, open your mouth and see whether there are any black lines or brown lines. Initially it would be brown lines which is going through the tooth, or at the next stage it would be black lines which is going through the tooth. Okay, so at that time just go to the doctor. Doctor will do a checkup and find out whether it's just a color or it's the beginning of a decay. Understood?
Okay,
so that's the layman's a way of finding out.
So there's a lot of different types. So even if there's color, you can you might not even have cavities. So, but it's better to take them off, right? If you have colors in your teeth, like black or brown.
Yes, because see, those are the initial stages of a decay. So why do you want to take it to a deeper stage and then go for a treatment which is more complicated? I mean, it's not so complicated, but still.
But it's better to take care of it.
To take care of that at the initial stage itself.
Yes.
We have got certain materials by the name Pitt and Fisher sealants, wherein if it's very small, we can fill it at that stage itself, and you will have a teeth for a lifetime.
Of course, I think it's very important to take care of our teeth, because once it hits nerves, and sometimes we're too scared to go to the dentist. I think a lot of people usually they're stressed when they go to the dentist. So is there any new safe ways to make the patients feel comfortable and at ease when they're checking up their teeth?
Okay, first of all, let me say that we dentists are not demons, so you can come to us, we can be free with us.
But the tools are very scary, they make very scary noise.
Yes. Mostly, it's not the fear of the dentist, the fear of the noise, as well as the fear of injection, which people say
it can be a little bit sensitive.
Yes, which people generally say that I fear dentists, but for the noise as well as for the fear of the
So it's not really
injection.
the dentist, just the equipment.
It's the equipment. So, but nowadays we have computerized, electronically guided injections, wherein the pain will be minimal to none. And also, we have hand pieces, that's the equipment which we use to drill the tooth. Understood? So, I mean, even I should not use the word drill.
Yeah, I just heard you say drill. I got a little bit scared,
Yeah.
I think anyone watching right now might not even go for a checkup.
No, it's not drilling. I should not use that word. It's removing the decay from the tooth. Okay. So earlier we had the normal ones. Now we have the electric hand pieces, which are, the noise produced by that is very minimal. Understood? And the ambience also nowadays in almost all the clinics is cool, calm ambience. So unlike before, now I think the fear factor has been reduced much more than before.
Of course. I think for a lot of people, sometimes even when they choose their toothbrush or even their toothpaste, there's a lot of different options nowadays. You can go to the supermarket or the pharmacy. So there's a lot of different types.
Yeah.
Which one is the best one for us to use?
Yeah, that's a very good question, and thanks for asking that question. Okay, mostly I get the question from people, from my patients, like asking which is the best toothpaste. But rarely do people ask which is the best toothbrush, maybe because of the influence of advertisements. Okay, so regarding toothpaste, generally, if you don't have any sensitivity for your teeth or anything like that, any toothpaste is equally good. I would say that the white toothpaste, the normal white toothpaste, would be good enough for you. But more than toothpaste, I would stress that you have to give importance for your toothbrush and how you brush your teeth. Your toothbrush has to be soft. Again, a personal opinion, has to be soft or extra soft, okay? And you should not press too much hard onto the tooth when you brush your teeth. You should be gentle, just like how you put soap onto your face. You are not so hard or rude to your face, right? So such gentle care should be taken when you brush. And the brushing action, the movement is very important. It should be up and down and not left and right like this, okay? And generally, it needs almost 2 minutes for you to for your brush to reach all parts of the teeth, of all the teeth, and you should brush twice a day, morning and night.
Of course, Dr. Mathew, we're going to take a short break. Dear viewers, we're going to take a short break and be right back. Welcome back, dear viewers. We're back with our special guest, Dr. Mathew Koshy, dentist and certified digital smile designer. Of course, we're talking about oral health. And to talk more about it, we'd like to know more about the benefits of floss and also the mouthwash.
Dental floss, as you know, is a string which we can buy from any supermarket or any pharmacy. Now, it is actually used mainly to remove the dirt from in between the teeth. So you have to tie it onto your fingers, and then you have to take it inside. So that helps in removing the dirt from in between the teeth where your brush cannot reach. And your mouthwash helps. Regarding mouthwash, there are different types of mouthwashes. Okay, generally your mouthwash helps to maintain the bad microorganisms in your mouth to a lower level, so that you can maintain good breath, as well as you will not have any gum problems like that.
Of course, I even heard like mouthwash is even very good for people with veneers as well, because even if you're brushing your teeth, there's a lot of different layers. So mouthwash also helps, as well as flossing, of course.
Yes, of course, because the mouthwash do help, flossing do help. Like, see, for a normal routine dental care, first you have to do your brushing, then your tongue cleaning, brushing, tongue cleaning, and then flossing. And after that, if needed, you can use the mouthwash also. Nowadays, you get that water floss also, which again will help you to clean in between.
But it's not
the teeth
really
to an
enough
extent.
for just the water floss. I think flossing as well is very important, because even the water floss can't even get all the areas.
Yes, yes, flossing, the manual flossing is the best.
Of course. And I think a lot of people might wonder, like, why do we have like sensitive teeth? A lot of people usually have sensitive teeth. Is it because of the toothbrush? Is it because of the toothpaste? What causes it?
Okay, I would blame three parties. First, like partly for the toothpaste, partly for the toothbrush, and partly for the person themselves. The toothpaste, you know, if it contains any abrasives or anything like that, too much of an abrasive, that can cause erosion, that can erode the enamel, which is a thin protective layer on your teeth. So that, and then the dentine inside contains lots of nerve endings. So because of that, once that enamel is eroded, you will have sensitivity. Now the toothbrush, if you have very hard toothbrush and you are brushing very hard, then that also can erode the enamel, and then you are going to have sensitivity. And the third, as I said, I'll blame the person, because if you brush very hard or in the wrong way, again, that will erode the enamel, and that will cause sensitivity again. So these are the general, like the common reasons for sensitivity. Apart from this, some people have the habit of, you know, taking too much of acidic foods and all that, too much of colas, then habit of grinding. You know, if you are in anger, you will grind your
that
tooth.
causes sensitivity as well.
Of course, because all this erodes the enamel away, and anything that erodes the enamel can cause sensitivity.
Of course. I think one of the main questions I would like to ask you is, what is digital smile design?
Oh, well, you came to my favorite topic and my passion. Digital smile design is a way in which we design the smile digitally before even touching the tooth of a patient. I'll explain a little more. Earlier, supposing you want to, you know, design a smile for you, or you want to keep few teeth, how do we say? We might show you a picture, we might show you some models and say, this is the way your teeth will be round here, straight here, something like that. Earlier, we used to do like that. Now, with the digital smile designing, what we do is that first we'll take your picture, 3-4 poses of your picture, and then we'll use that picture. We'll put in the software. There are lots of softwares, and the one in which each doctor uses, they will put in that software, and then they will superimpose different different teeth models which they have with them, and there is a huge library of teeth models from which you can choose. So you can superimpose on your tooth, and along with that we'll superimpose, we will put your X-ray, CBCT X-ray and all that, wherein we can have your bone also. So by this, we create a digital patient, we digitalize you. So even when you are at home, we have you with us.
That's a little bit scary, but okay.
No, and on this digital model, we can design the teeth which suits your face, you know. The teeth design and the design of your gum and all differs from person to person, differs from the shape of the face and there are lots of parameters which you have to take. So all this together is called as digital smile designing, and once we design it, we can show this on the patient's tooth also. Like we do a 3D printing of this design, and we take a impression of this, and with a material called as a temporary material, we can put that on the patient's tooth, and the patient can see how it will look after they do the treatment, even before they start the treatment.
Of course, I think that's great. There's a lot of different ways now with technology to develop a lot of different things, because as you mentioned, there's the x-ray for the bones, there's the 3D printing, there's a lot of different things before even starting with the process.
Yes, so that's a great advantage, because see, you know where you go before you reach, before you start.
Of course.
That's a big advantage.
I think that's very important to see the outcome before you begin.
Yeah, but I would say there are two cautions to be taken. Like, you know, when we say that we can do this left and right, I should not give too much of optimism, because whatever we say, whatever we do is within two parameters, like function and biology. Like, you know, supposing you choose, or we both together choose one teeth which is long, and at the end you cannot close your mouth, what will be the condition? So that function, and then the biology, like it should not hurt your gum. There are a few parameters which you have to take care of. So within that parameters, there are lots of options to be done.
Of course, and thank you so much for sharing all this important information with us, Doctor. It's really a pleasure to have you here in the studios of Hala, Kuwait.
Thank you.